Hi, people. Hi, humans. Yeah, we're humans. This is Upstream Health here again. Upstream Health with Ify. How are you guys doing? I hope you're all doing well. Okay, so today I am going to be talking about our kidney. Kidney health is a very, very important topic, and I want you guys to pay attention. I want you to listen because the kidney is very, very important. It's a very, very important organ. And on that note, I just want to treat my kidney well before we start. So, where is the kidney in our body? Our kidney is here, positioned here, and we have two of them right here. Okay, so what does the kidney do? Why is the kidney important? The kidney is very important because it helps remove waste from the body. Waste like the urine, waste from processed medications. Your kidney is also very important in red blood cell production. Your kidney is very important in your bone health when we talk about calcium and vitamin D production in the body. Your bone health depends on your kidney. Your kidney also is very important in controlling your blood pressure because your kidney is involved in the sodium, potassium. Let's put that. I don't want to use the word sodium, potassium. So, involved in your blood pressure control. And your kidney also is involved in acid-base balance, in ventilation, that's in breathing. So that's a different topic. It's also, your kidney is also involved in water balance, in taste. Okay, the kidney is a very, very important organ, and I'm gonna be talking more about how the kidney takes out waste from your body, how it processes medication in your body. Okay, so now let's talk about how. Let me just give you a quick rundown of what happens in the kidney. So the kidney right here has like two outlets. Let me use that word, two outlet. Remember, I'm trying to make upstream health very simple. I don't want to use all the medical jargons because I know my audience are people with low health literacy. They don't understand those health jargons. I'm making it very easy, and I'll use very simple terms so that you can be in the flow with me. Okay, so I'm gonna give you guys a quick rundown of the cycle. All right, like when the clean blood gets out of the kidney. So let's say this is one of the kidneys, and let's say this is a vein, and let's say this is the ureter. That, like, this is the ureter is the pathway or path through which the urine travels to your bladder. So let's say this is the kidney. The kidney has what we call filters or nephrons, right? So the filter or the nephrons cleans out the blood. All right, the clean blood, which is without oxygen, right, will go through the vein. And from the vein, here, let's say this is the vein, right? The clean blood without oxygen goes through the vein into the heart. It travels back to the right side of the heart to your lungs. In your lungs, the blood will pick up oxygen and then travels back to the left side of your heart. All right, and from the left side of your heart, it travels through a major artery and down and begins to feed every other organs and tissue in the body. And along the way, it picks up waste also and comes back to the kidney. All right, and the other process also for the kidney is making urine. Remember, I said the clean blood without oxygen out from here to the heart, and the other pathway which leads to the bladder takes the urine, and when you have sensation, the bladder will release the urine. So this is very important. Okay, so we talked about red blood cell production, bone health, acid-base balance, blood pressure control, medication, processing, removal of waste, right? So now let's talk about the things that damage the kidney. One, you saw me, I drank my water. Hydration is a huge one. Hydration, you need to hydrate yourself every day. The kidney needs the water. Okay, so like I said initially, the kidney is like a laundryman or like a washing machine. So imagine, like I said, if you don't feed your washing machine with water, it's not gonna wash properly, right? It's not even gonna wash. So that's one. So drink water. Every adult needs, or for men, based on your weight or your build, men will need at least 3,000 ml of water a day, and women at least 2,500 ml of water a day. Okay, hydration is important. And a second one, again, that damages the kidney is smoking. No smoking. Okay, if you're smoking, begin to plan on how to stop smoking. Okay, do not go cold turkey. Work with your provider, your healthcare provider. They can give you resources or some treatments for you to stop smoking. And then the third one is alcohol. So we need to limit our alcohol intake. Okay, so for men are required, it's recommended that men can have 1 to 2 standard drinks a day. Women, one or less standard drink a day. And when I mean standard drink, there is a percentage of alcohol in the drink that you're having. Okay, I know we have beer, we have liquor, we have spirits, we have wine. There is a required amount of alcohol. Okay, men 1 to 2 standard drinks a day. That's for alcohol. And another one is controlling blood pressure and diabetes. If you have a history of high blood pressure or diabetes, or if you're managing blood pressure, the blood glucose, you need to take your medications as prescribed. Do not stop your medications without informing your healthcare provider. So when the blood glucose is not controlled, the glucose overburdens the kidney. It damages the nerves, it damages the veins. Okay, so you need to take your medications as prescribed. Do not stop your medications without consulting your primary care provider. So another huge concern about things that can damage the kidney is herbal medications, um, herbal medications. So if you want to start taking herbs or supplements, make sure you're speaking to your healthcare providers. Okay, my concern about herbs, especially when you cook them up yourself or mix them up yourself, is that it doesn't have any standardized dosage. There is a limit that your kidney can take. When you pick up medications, you find out that the pharmaceutical companies are writing, take 1 tablet a day or 2 tablets a day. Do not exceed 4 tablets a day. Do not take more than 4,000 milligrams a day, because they know that your kidney and also your liver cannot take more than that. Okay, herbs, most especially, can be very toxic. So make sure whatever you're having, you're reading it up to make sure you're taking the right dose. Do not self-medicate. Do not share medications. Okay, do not share medications. You can check your blood pressure and you feel, oh, it's high, and oh, my dad is on blood pressure medication, I can go take it. No, every one of us have a level of kidney function. All right, kidney function can determine the kind of medications you take. A lot of medications in the antibiotic family, diabetic medications, requires your clinician to look at your GFR, your kidney function, before they prescribe that medication to you. So for some medications, if your kidney function, which is a GFR, a normal GFR is 60 and above, there are some medications we cannot prescribe to you if your GFR is less than 30 or less than 45 or even less than 60. So you need to be speaking to your primary care provider. Find out what your numbers are. What is your GFR? Do not self-medicate, especially antibiotics. Do not medicate with antibiotics. Always work with your primary care provider. Okay, and another medication also is a group of medication we'll call Nsaids, like the ibuprofen. Ibuprofen is not meant to be used for a long time. That can also decrease your kidney function. Ibuprofen. If you have pain, rather take Tylenol. And even with Tylenol also, you have a limit that you can take, because that can also damage the liver if you take above a certain dosage. So always work with your primary care provider. Medications, you need to work with your primary care provider, because they can be good in treating you, and also they can be bad in damaging your kidneys. Make sure you're taking the right prescribed dosage, okay? Like I said, keep the blood pressure under control, keep the blood glucose under control, okay? Take your medications as prescribed. And another one is the red meat. Red meat in moderation, okay? Red meat in moderation. A lot of red meat also is damaging to the kidney. Another one is always move your bladder when you feel like when you want to pee. Do not hold urine in the bladder. When you hold it for a long time, it can also cause UTI, urinary tract infection. Okay, do not, as soon as you find a quick exit, go and empty your bladder. Do not keep urine. And if you have urinary tract infection, do not self-medicate. Work with your primary care doctor and get early treatment. Do not delay UTI treatment. That can be damaging to your kidneys, okay? And before I forget, I was talking about GFR, normal GFR. So I want to quickly talk about age. Do you know that with aging, our GFR, that's our kidney function, decreases? Yeah, our GFR, that's our kidney function, decreases. Remember, I told you a normal GFR is 60 and above. So as we age, from the age of 30, our kidney function decreases. So which means if you turn 50 or 60, your primary care doctor will begin to adjust your medications based on the number of your GFR. So, which is why self-medication can also be dangerous. So, your medication is dosed based on your kidney function, GFR. Okay, so there are some people with what we call chronic kidney disease. At that time, you see urine, and the kidney is not able to filter the protein. They see protein in the urine. We have stage 1 to 5. The stage 5, which is the end stage renal disease, is where the kidney functions at 15%. Remember, I told you normal is 60 and above. So when the kidney can only function at 15% and less, the patient is likely to go on dialysis or even placed on a queue for kidney transplant. So we don't have to wait till our kidney gets damaged to a stage 5 or to end stage renal disease before we start taking care of our kidney. So start now, start early. Go back upstream, check what you eat, check what the medications you take. Work with your primary care provider on your medications. Do not self-medicate. Make sure you're drinking water. Okay, make sure you're emptying your bladder. Okay, and make sure you're eating plant-based diet, especially if you have been diagnosed of a chronic kidney disease. You can go plant-based. You can speak to a dietitian or nutritionist. You can go plant-based to prevent the worsening of the kidney disease. Okay, so on this note, I'm gonna be ending it here, and I want you all to have a very beautiful, beautiful evening. And please don't forget to like, comment, share, and also click on the notification button so that you will get an alert when I upload a new video. If you haven't subscribed, please subscribe. We're gonna be having a lot of fun on this channel. Okay, and I'm getting a lot of input from you. So I get a lot of input from you guys. That way I know what topic to bring out here. This is not about me. This is not, I'm not in total control. You guys are. So tell me the topics you want me to talk about. I'll say it here. And also go to my Instagram page, subscribe, and then send me your questions over there. Okay? Thank you for sticking with me, and thank you for trusting me. Bye, and have a blessed evening. Bye bye.